Hello, folks. This is Dr. Mike, and welcome to the MES Mastermind Group. Today, we're going to talk about medical exercise training, the new modality. But what we're specifically going to do, I'm going to go over how to make this presentation to doctors, therapists, and chiropractors, community leaders, community groups, when you go out there and you now start pitching your medical exercise training practice. Now, it looks like our camera is going a little bit slow here today. Let me see what we got here. All right, let's see here. There we go. I think that's a little bit better now. Take a little bit of time to kind of initiate there. All right, there we go. Just want to make sure that we're coming through here pretty good. Let me also make sure we control our volume. Our volume here is good. Yes. All righty. All righty, look like we got some folks that are starting to come in here. Let's see what we got so far. Hey, there's some folks that are coming in. All right, it looks like we're live. Look like we have some folks that are starting to come in. Can't view the group though. Okay, I just want to make sure that our presentation is going live here, so give me just a second. I don't want to miss anything here for you. And let's just see if the feed is going out on Google. So hopefully you guys are getting it. All right, it looks like we're live out there. That's good. Okay, we're going to go ahead and get started here. Let me just check this live feed to make sure it's coming in okay. And our audio is good. We've updated our computers here. I'm a big Mac user. Yeah, no, looks like it's good. Live feed, make sure it's coming in okay. All righty, okay, we're going to go ahead and get started then, folks. Okay, folks, good afternoon again, and welcome to the MES Mastermind Group. Today, we're going to talk about how to make the presentation to your participants, whether you're making a presentation to a group of doctors, a group of therapists, community leaders, local medical support group. We're going to talk about how to make that presentation. So we've got a little bit of a skipping going on here with our video this morning. And what I don't want to do is start the broadcast all over again. But every once in a while, it looks like the feed is catching a little bit. Let's try this. Let's go with this. We got to. Okay. Hey, Yuli, how are you doing? Hey, Tanya, how are you? Hopefully, both you guys are doing well. How's that feed coming in out there for you guys? Is it feed coming in pretty good? Oh, I think we may have lost it. Yeah, I think we lost the feed there for a second. Oh, there it is. It's back. Okay. We switched to another Wi-Fi service, and I think this actual Wi-Fi is going to be better. Fantastic. Okay. All righty. So if you're listening in out there, hopefully you guys are able to hear everything. Audio is working well. It's kind of interesting how dependent we've become as humans on the internet and Wi-Fi, and how sometimes it just says it's going to do what it wants to do. So hopefully we're good right now. All right, we're going to go ahead with our presentation here. And let's see. All righty. Hopefully now we're back. My apologies, folks. We got a little bit of Wi-Fi problems here. Let's see what we got going on here. It's just going to give us what we want. Okay, yeah, looks like we're back. All right, fantastic. I'm at my home office today. Let's just make sure. All right, looks like it's doing pretty good. All righty, we're going to go ahead and do our presentation here. Let me make sure we haven't lost anyone. Yeah. It looks like everybody is still there. This is telling me we still got folks that are here. So please hang tight with us, folks. Hopefully we're going to get through this and go from here. So let's see if we can get to our presentation here. We're going to go full screen. So we're going to go to our time tunnel here. And we're going to open up the presentation we have here, titled Medical Exercise Training, the New Modality. Now, this presentation I put together about a year or so ago, and I put it together specifically to give our MESs a method of actually, or a presentation they could actually go out there and make to the medical community to show all the great things that medical exercise is able to accomplish. And I think thus far, it's been a pretty good presentation. People use it, I think they utilize it very well. And looks like now we're getting that presentation that's coming up there for you. Hold tight, let's just make sure it comes up all the way. Alrighty, there we go. Now, folks, if you notice here, hopefully you can see here to the right is the slide itself, and over here to the left are the actual slides that we'll go through. So you'll be able to see what actually is coming up in the next slide. So we start our presentation normally after you've done all the greetings and met everyone and exchanged pleasantries and everything. You'll get the group to sit down. Now, if this is a group of doctors or a group of therapists, you're doing this as a lunchtime presentation. What happens is the doctors will straddle in last and the physical therapists will straddle in. But normally what you'll have is usually the office manager is the person who will meet you, help you get set up wherever you're going to do your presentation. And I would recommend that you take a tablet, and if you have also a laptop, take that along. Because sometimes you'll be surprised. Some places will have flat screen TVs mounted on the walls for educational purposes in their break area. Some places won't. So you just need to make sure you take along all of your media capabilities so you can give the clients what they want and make sure they get a good presentation out of this. Once you've done all your greetings and everything, I'd recommend at that point you introduce yourself and just give them a brief overview of who you are. So for instance, this is what I would say. Folks, my name is Michael Jones. I'm a medical exercise specialist. I'm the president of Medical Exercise Specialists of Katy, Texas. And what we do is bridge the gap between healthcare and fitness by developing, designing, and progressing clients through exercise programs, regardless if they have musculoskeletal, neurologic, cardiovascular, metabolic disorders. We do not provide any aspect of physical therapy services, nor do we provide any aspect of chiropractic or medical services. Our program, we use one modality and one modality only, exercise. Now, we know exercise is the key to long-term management of most medical conditions. And as physicians or physical therapists or chiropractors, you all realize that when you treat your patients, you provide the best of care. At some point, the insurance carrier may cut you off. And in many instances, these patients need ongoing care. Well, we're the folks that provide that ongoing care. So if you would think back for just a second of a client or a patient you've had, that you had to discharge because their insurance benefits ran out. You didn't think they were quite ready to participate in an exercise program in the health club because you didn't want them to re-injure themselves. They weren't quite ready to go back to work because they still had functional deficits, but you wanted to put them in an exercise program and you didn't know where to send them. Physical therapist, doctor, chiropractor, nurse, massage therapist, athletic trainer, you send those people to us. We actually are trained specifically as medical exercise specialists to provide exercise to those clients after physical therapy, chiropractic, and medical care is done. So now at that point, this is our first slide. You now pretty much explain who you are, what you do, how you do it, and who you do it to. Write that down. Who you are, what you do, how you do it, and who you do it to. Next slide here. Okay, now notice on this slide, this first slide has got all your contact information on it. Normally we would have your logo down here in the lower right-hand corner. We would have our Medical Exercise Training Institute over here on the other side, and that would take us to the second slide. So now this second slide, we do have some alignment issues down here at the bottom, but we found that those alignment issues still allow everyone in the audience to understand exactly what you have to say or what the presentation is about on this slide. So here's how I would start this. So let me transition from this slide to the next one. So folks, with that, we provide medical exercise training. This is the new modality. We're finding now that patients have to take more responsibility for their own care. You as physicians and physical therapists now have to move clients out of the facility faster. And that's led us to an interesting situation. We now have a mandate for change. We're seeing changes in our healthcare system and with insurance carriers that are now mandating that exercise become a strong component of the medical aspect. We also know that we need to integrate medical protocols and guidelines into the healthcare management process. Well, medical exercise training, which is what we do, is the concept of delivering exercise programming to clients that have medical conditions. Now, it's interesting enough, we're going to transition to the next slide. Interesting enough, folks, we have some interesting statistics about what we call the Big Five. Now, this Big Five are 5 conditions that we know would have a positive impact based on exercise. Diabetes, hypertension, low back pain, osteoarthritis, and total joint replacements and hip replacements. Now, we realize total hip and knee replacements are not medical conditions. They're actual procedures, but let me give you a little bit of statistical information here. Diabetes affects some 25.8 million Americans at a cost of roughly $245 billion. Now, these statistics are a couple of years old. We know that diabetes type 2 can be easily managed with diet and exercise. Hypertension, it affects 67 million Americans at a cost of $93.5 billion. Hypertension is easily managed with exercise and diet. Low back pain. We know at some point in their lives, 80% of Americans experience low back pain. Now, the cost for low back pain management for 2010, now this is 2016, so this number has gone up, was $100 billion. If you add the cost of surgical procedures such as laminectomies and fusions to that price tag, it goes up another $15.6 billion. Now, we know that a structured progressive exercise program can help with low back pain. Osteoarthritis. All of us at some point will have osteoarthritis. Well, did you know that there are more than 400,000 hospitalizations a year alone due to just osteoarthritis? 27 million Americans suffer with this at the cost of $89.1 billion. Now, osteoarthritis is important because it leads to our next component here, total hip and total knee replacements. These are done as a result of functional loss due to osteoarthritis. The primary reason we go in is to actually restore this client's function with a hip or knee replacement. And look at the numbers here. Annually, some 450,000 total hip replacements are done. And this is an interesting number to me. 720,000 total knees are done annually. I thought for sure hips would outrun knees. Here's what we know. Our healthcare systems are buckling under the cost and numbers of individuals with chronic disease. We're losing the battle here, folks. And we're losing the battle all because we're not adding one significant component to this, which is what? Exercise. We need the exercise component in this to get started. Now, I just got someone that said, asking me if everything was okay. So I'm wondering if somebody's not getting in. Hold on one second. Let's just make sure that Susan got in. And what I'm going to do is stop my screen sharing here for a second. And let's go back to me here. Let's see here. Okay. Okay. Guys, I just came back. I got Susan's text. Okay.